It's muddy. When, when I'm at home, sound is really muddy. Is there any way to improve that? Or
Never
adding a
check that.
second box or something? Personally, when Lenny was sitting back where I'm sitting now, I had a lot of trouble hearing her. When I was at home.
Your journal.
Let's see what's possible.
Chris, you still with us? We're moving into the six division. Hold on. The textile side. No, thank you.
Your twin, Kimberly. Son las muletas.
Signature 51 p.m. Thank you. Okay, everybody's here, yeah. Okay. President Rogers,
I think she's here. I think she left in.
we're doing roll call. President Rogers, you're now convening to the foundation. Vice President Rodriguez.
Here.
Secretary Barraza. Here. Director Lodge.
Here.
Director Delara. Here. Director Perezkiel.
Here.
And Director Schuler.
Here.
Okay, item B, approval of the agenda, I entertain a motion to approve.
So moved.
For a second,
Second. Oh,
any discussion, all in favor, say aye.
aye.
Any opposed, abstentions? Public comment, I'm not gonna read out, we do public comments since you heard it earlier, is there any public comments, Andrea?
No public comments, no.
Stuff in the room. Item D is the consent agenda, we have the board minutes, financials and agreements, any items to be pulled? Not gonna entertain a motion to adopt the consent agenda,
So moved.
is there a second? Thank you, any further discussions? If not, Andrea, roll call.
President Rogers. Vice President Rodriguez.
Yes.
Secretary Barraza. Yes. Director Logston.
Yes.
Director Delara.
Yes.
Director Perezkiel.
Yes.
Director Shore.
Yes.
And President Rogers, we're voting on the consent agenda.
It's possible she misunderstood like I did. I thought we were taking a 5-minute break, so she may be away from her computer. I'm not sure.
Item E reports is 24th annual mobile health clinics conference. The one,
Yes, so this is the Mobile Healthcare Association Conference. We're new members, so we had a team of Desert Healthcare District staff participate in this conference. Staff included our CEO, Chris, Donna, myself, Megan, and Sergio. Really interesting breakout sessions. They had mobile medical unit builders there that a whole fleet of them, very different shapes and sizes. There was also even portables instead of, there was the trailer that expanded out that almost made like a room, like a whole examination room. So really interesting resources there. I participated in the partnership panel, that went very well, and then Sergio and Megan presented our poster as part of the poster session there at the Mobile Healthcare Association Conference. We came back with a lot of knowledge, a lot of really good contacts we also made with other mobile health operators throughout the nation. Part of our panel, our partnership panel, we got really good feedback. They actually asked us to come back and do a webinar on the partnership panel, because there was a lot of really good interaction and feedback from that. So overall, I think it was a good, conference for us to attend and start making those connections with other mobile healthcare, clinic operators, so.
Any questions?
And all these key session highlights, we all split up and took different
Oh,
ones, so these are comments from all of us that attended different sessions.
Right, and item number 2 is DPMG.
We have a video we want to share really quickly.
Oh, okay.
Is this the time?
Yes.
Hold on a second. Just a sec, let me share it. Alright. And did I hit the, I don't know if I hit the sound, you guys. Can I do it over here once it's sharing?
Yes, I'm here.
You're good.
Click share again, Andrea.
I'm good. You're already sharing the audio.
Computer sound, stereo, high fidelity.
Doesn't matter.
High five.
We're here today at one of our multiple weekly
We can't hear it, hold on,
It's the volume at the bottom right.
sorry. It's on. Huh,
Who can't hear it?
no, it just sounds like it's low.
Yeah, just turn your volume up on your screen.
Well, the remote's over there to the
On the bottom, and there.
to the TV and then over here.
It's on the right.
We could hear it virtually.
Okay,
Look at the far right, you have a little.
there we go, I got it.
We're here today at one of our multiple weekly deployments of our medical mobile clinic. Today we're here in the city of Desert Hot Springs with our homeless outreach, where we're providing medical services. We're also providing, through other partnerships, we're providing showers and other supportive resources through the county Department of Behavioral Health and also social services.
The healthcare districts act during the COVID-19 pandemic really illustrated to the organization that there was a need to go out to the community to reach residents, because the normal traditional ways to seek medical help was not available to residents. So the district took the medical access to the community and to the residents in the areas where they need it most, in the farm worker communities and in the homeless communities, etc. And so it really illustrated to the healthcare district for a need for mobile healthcare clinics.
I think the goal with our whole initiative with the mobile units and Desert Physicians Medical Group Health in connection with the Desert Healthcare District is really to expand healthcare access and bring healthcare equity, especially to those vulnerable populations that really need healthcare and maybe more reserved not to seek it out, or maybe don't even have the transportation or the means to accept healthcare.
Typically on a weekly basis, our medical mobile clinic is out 3 or 4 times a week. Sometimes we deploy the mobile clinic multiple times during one day in one location. For example, here today in the city of Desert Hot Springs, we're at the Access Hub that caters to the unhoused population. And then later in the afternoon, we'll be at the Senior Center providing services for the seniors. So we're very busy.
So we go out to all the different sites. That's where our connection and collaboration with the Desert Healthcare District has been so important, because that allows us to reach all those communities in need. So we've gone out to churches, we've gone out to schools, we've gone to the farm fields, to senior centers. So really anywhere that the need is, but our focus is on those vulnerable populations that don't have access to healthcare.
So our mission is to achieve optimal health at all levels of life for all district residents. And so it meets it perfectly, because like I indicated, non-traditional ways of providing access to healthcare for our residents.
Through this program, we have established wonderful partnerships, and also with our funders, from the Coachella Valley Resource Conservation District that believed in this concept early on and were able to provide us grant funds to purchase both medical mobile clinics that are out in the community multiple times a week. So for us, partnerships are key. We couldn't do this without our multiple partners, from the hosting sites and to the other organizations that bring additional services outside of the medical service that we're able to provide through our mobile medical clinics.
We're seeing shower units coming up, which has been tremendously helpful.
We go up here to Desert Hot Springs on the third Thursday of the month. We try to provide showers from the homeless here in DHS. On that Thursday, we go between 15 to 20 showers, try to do the best we can and try to provide that service for the folks that are in need. At the end of the day, that's what it's providing. It's a service for them. And we all know once you get clean out of the shower, you just feel better. And one of the other things we do with our Main Street is we not only provide the showers, but we provide socks and underwear, which we know socks for non-housed is a huge deal. Like all of us are going to need a hand up every once in a while, and that's what we hope to provide to you.
Well, we have crisis center vehicles that are coming out with us. We have donated clothing, food, etc. I think all of the needs that patients have, in addition to the healthcare needs.
Being able to provide these services to the community is life-changing. It is life-saving. Being able to get haircuts, provide shoes, clothes, luggage, things that are necessary. It's pivotal. It makes a difference.
The mobile team clinic has helped me in a lot of ways, actually. Showering, getting food, getting clothes, doctors. When you guys are coming to help us, I feel like you guys really care.
I don't even have enough words to say how grateful and thankful I am for Desert Healthcare partnering with us. You have to have a heart. It's a job, but you have to have a heart and know that nobody, when they were little, dreamt about being homeless. Nobody dreamt about not having someone to care for them or to be able to get medical services as a human being. And the services that are being provided here is priceless. So thank you.
Nice. Nice.
Any questions, comments?
That's where the rubber meets the road.
Literally,
President Rogers has a question or a statement.
Oh, I just wanted to applaud Alejandro for his great work throughout the valley with the mobile medical van and our partners at DPMG and all those wonderful people that support us, the shower people and the Word of Life. We have some great partners out there, and kudos to Alejandro for coordinating it.
Thank you.
Right.
Item F is committee meetings. Again, at the finance administration and the program committee, any items, questions for Nicole?
we got a E2.
E2. I thought that was a DPMG.
I just want to provide a quick update on on our women's wellness clinics. We started back up. We had a very successful one this last Saturday at St. Louis Catholic Church in Cathedral City. We provided mammograms and pap smears. This Saturday we'll be at Indio Middle School. Same setup, providing pap smears and mammograms. And then November 15th, we'll be at Misión San Juan Diego in North Shore, providing the same services to the women out there in that area. So throughout these 6 events that we've partnered with the Pink Journey Foundation, the one in November will be our last one. We've had these events throughout the Coachella Valley. We've had them in Coachella, Mecca, North Shore, Indio, Palm Desert, Palm Springs, Desert Hot Springs. So we're making sure that we have multiple access points to all the women throughout the Coachella Valley to ensure that they have the mammograms and the pap smears. And one of the key data points that Megan did a phenomenal job with the data sets for our presentation that pretty much shocked a lot of the attendees at the Healthcare District Association. The California Healthcare District meeting was that 20% of the women that we see for the mammograms the first time receiving a mammogram, which is outrageous, and 17% for the women who are receiving a pap smear. So we're making a big difference out in the community for providing these access points to the women who qualify.
These all uninsured people who are,
It's a mix of insured and uninsured. Some of them, they cannot get an appointment with a primary care physician to have these types of exams done, or even you know, to even have a secure an appointment with an OBGYN provider to kind of have some of this.
Finding, no morbidity, how do you find it? Positive results?
Right now, we're averaging 2 or 3 callbacks per event. Per event. That's huge.
But
That's huge.
it is huge.
That's huge.
There's a number, how many do you treat per clinic roughly, or how many do you treat in that clinic?
Right now we have capacity to screen 45 women per event.
Well, we talk about like numbers needed to treat is like a very big number, big statistic that we use in a study. You know, it's very rare for these numbers needed to treat to be like under 1 in 300. That's a very successful study.
Wow.
And now you have like 2 in 45 or 3 in 45. That's 1 in 15. Like, that's crazy.
And right now Sergio is working with one client who they detected a stage 4 cancer in one of our first clinics that we did out in Mecca, and he's been just godsend to this lady who was undocumented,
Yeah,
she's
of course.
uninsured. And Sergio has, you know, worked with DPMG how to get letters written by Dr. Gemma Kim in order for her to get resources from the Pendleton Foundation, who's actually playing for the Cure Foundation. And then he was able to enroll her in emergency medical to ensure that she was taken care of for any additional, you know, biopsies or any other interventions that she could get for respiratory cancer. We even connected her with Fine Food Bank, so she's able to pick up a food box once a week for Fine Food Bank to, you know, to ensure that, you know, she has food in her home.
Wow, good. Very good.
Wow.
Right, again, finance, legal administration, real estate or program committee, any questions or anything? Cool. Not any further board member comments? If not, we will adjourn at 7:06 to close session.
5 minutes.
Thank you.
Famous last words.
Other than, I guess,
Be quick, right?
Yeah, it's gonna be quick. I got it all.
You got all
I can
summarized.
help quick,
Okay.
like 15 minutes.
Probably less.
Cause I have to call for my right